It's a lot faster than a 4 to 8 hour infusion. Okay, this one will be in my belly. All right, we're gonna do another one. I never get used to them. Yeah, it's been a long journey.
39-year-old Neely Freeman lets her 8-year-old daughter, Ava, help place the needles.
All right, we're gonna do another one.
The needles will deliver immunoglobulin therapy, which will block antibodies that attack Freeman's body.
Good job.
It was when Ava was a baby that Freeman began having trouble picking her up and holding her.
And it didn't make sense to me because the more she grew and the heavier she got, the weaker my arms felt that I couldn't hold her.
When Freeman told her doctor about her weakness and exhaustion,
I feel like it's pretty occasional.
She was diagnosed with postpartum depression and prescribed antidepressants. Her health kept declining. She had trouble swallowing. A career nurse, one of Freeman's colleagues, asked why she didn't smile anymore. Her muscles were weakening. It would be over a year before she would be diagnosed with myasthenia gravis, known as MG.
I didn't know what it was. I thought, okay, I remember learning about this maybe on one slide in nursing school and never talking about it again. I knew it was a better diagnosis than ALS, that it was treatable.
Okay, so Ms. Freeman, since the last time we met, maybe I make a new diagnosis every other week.
Dr. R. Carolina Garcia Santibáñez is an Emory neurologist who has expertise in myasthenia gravis.
Okay, just today, 3 of my patients were myasthenics.
Myasthenia gravis causes weakness in the body's voluntary muscles, like the ones we use for breathing or talking or moving our arms and legs.
It is an autoimmune disease where your body produces proteins, in this case antibodies, that attack the neuromuscular junction. The neuromuscular junction is the part where the nerve and the muscle communicate in order for you to move.
A chemical called acetylcholine helps signals pass from nerves to muscles to make them contract. But in people with MG, antibodies block or destroy those signals, making muscle movement difficult. Symptoms of myasthenia gravis include droopy eyelids, blurred or double vision, slurred speech, trouble swallowing, weak arms, legs, and neck, shortness of breath, and breathing difficulty. While researchers know MG is due to antibodies against proteins in the neuromuscular junction, what they do not know is what causes autoimmune diseases like this in general. MG tends to impact women in their 20s and 30s, and more men than women in their 50s and 60s. It is rare.
The incidence of myasthenia may be around like 3 per 100,000.
I didn't think I had symptoms until that Saturday when my speech totally went. When it comes to holding cups, sometimes you'll pick up a cup and you think you've got it and it's gone. So, nothing.
Rick Sullins is a talented musician who was diagnosed with myasthenia gravis.
My MG is bulbar, primarily this area. I struggle heavily with mucus. Where your esophagus continually pushes mucus down, mine doesn't. It just builds. This is Saturday, 18th. And this is behind the scenes that people don't see, the hard parts of the MG.
Sullins shared videos of himself and the slurred speech that is the result of the chronic autoimmune disease.
It's very hard to swallow. Breathing is labored.
How are your symptoms going?
They call it snowflake disease because, no two people that have it are the same.
So the psoriatic arthritis.
Case in point, Neely Freeman has seronegative myasthenia gravis, meaning the standard blood tests don't detect it, making diagnosis more difficult and often delayed.
With the plan with the rheumatologist.
As many as 10 to 15% of MG patients are seronegative.
It is clear that
And Dr. Garcia sees patients from around the country because she does the specialized testing to confirm the disease.
But I had no clue what fatigable muscle weakness really was, because I was a person used to being very active, and I didn't realize the lifestyle change of having to be less active so that you weren't fatiguing your muscles. So that didn't compute with me. I didn't know how to slow down.
Freeman had to leave her job as a nurse at Children's Healthcare of Atlanta.
You kind of question your roles, like, am I still a mom if I can't take care of my child? Within a year and a half, I had had 5 myasthenia crises, which means your respiratory muscles have stopped, or my swallowing muscles have stopped, and my airway was compromised, and I had to be intubated and ventilated.
It limits you as to what you can and cannot do. And that's the part where the depression comes. That's where it gets hard.
Sullins was also hospitalized and critically ill multiple times.
A myasthenia gravis crisis, when there is this worsening of the myasthenia gravis condition and patients have this more rapidly progressing difficulty breathing and swallowing that often lands them in a hospital.
Hey, Dana.
Sullins and Freeman failed multiple treatments for MG, so both did a treatment called plasma exchange. This several hours long process is similar to dialysis, in which the blood is taken from the body and the plasma, which contains the harmful antibodies, is separated and thrown away. The remaining blood cells are mixed with the replacement fluid and returned to the body. After doing this for years, now Sullins and Freeman both receive a drug called efgartigimod, brand name Vyvgart, which has been a game changer for many people living with MG. It was the first FDA-approved treatment specifically designed for adults with generalized myasthenia gravis. It has been called plasma exchange in a bottle because it works in a similar way, but through medication rather than a blood cleansing procedure.
I'm blessed with a wonderful home nurse.
Sullins cannot walk long distances and tires easily.
I can walk about 80 to 100 feet, and I'm done.
He says infusions of efgartigimod allow him to still play.
I love to play.
Push, push, push. There you go. All right, you want to go sit in the bike?
Efgartigimod combined with IG therapy
All right, I'm turning around here.
has changed Freeman's life. Now a married mom of 2, she can keep pace with her life.
I was walking around the neighborhood. I was taking the electric bike out. I didn't need the breathing assistant anymore. I could take my kids to the zoo and walk around. Lots of movement. I've discharged 2 patients.
She is doing so well, she is back at the job she had to leave 5 years ago.
I'm a cardiac nurse at Children's Healthcare of Atlanta. I love it. When you work with children that you learn, and you also learn their resilience teaches you so much.